There are dramatic price differences in what hospitals charge. That is true, even if it is for the same procedure. The findings come from a new unprecedented government report. A joint replacement can range from $5,300 to over $200,000.
Treating COPD, a respiratory disease, will cost you $7,000 in the Bronx, New York, but just 30 miles away in New Jersey, it's almost $100,000. The report was inspired in part by a Time magazine story. It's called Bitter Pill, Why Medical Bills Are Killing Us, by Stephen Brill. Broke a lot of ground here. All right, so we have suspected, and I should say Times editor-at-large is joining us this morning, Jeffrey Kluger. I'm so interested in this subject, wanted to get straight to it with you. We knew that there were disparities, but
That's right.
This large? I mean, how can that be?
Well, a lot of that has to do with the fact, and we report this today on Time.com as well, that when you and I come to a hospital, we are uniquely vulnerable. We're also uniquely afraid. I'm not inclined to come into a hospital when my life is on the line and negotiate. This isn't like arguing over whether my car is going to have undercoating.
But why would insurance companies that seem to bilk the patient for everything, why wouldn't they go back at the hospitals if they're overbilling?
Well, they do, but this is what happens. When Medicare pays for something, they calculate what they're going to pay based upon what it actually costs, including overhead, salaries, what it costs to keep the lights on in the hospital. They go by the quaint notion that nonprofit hospitals should be nonprofit. When the hospitals use their charge master, their double secret pricing menu, they send those outrageous bills to insurance companies. Now, insurance companies can still negotiate them down, but if they're charging 20 times too much and they negotiate them down by half, that's still 10 times.
What's interesting about this is healthcare reform had more to do with access than cost.
That's
cost
right.
continues to be the big problem.
Exactly.
So what can be done to change this?
Well, one of the things that's helping a lot is, in addition to releasing these numbers yesterday, the Secretary of HHS has also allocated $87 million for pricing transparency centers around the country. And this will, A, allow you and me as consumers to comparison shop, just like the health insurance exchanges. There's also some talk that the government may require the pricing transparency centers to force local hospitals to charge the average of what insurance companies pay. So at least we'll have some reins on this.
Hard to check the cost when you're having a heart attack.
Yeah, exactly. I didn't say to the doctor, "You sure I can afford this?"
Yes, right.
Thank you, Jeffrey.
Thank you.
Thank you.